Imagine getting off the shower and then you notice something strange, or just randomly when you were going about your day-to-day activity, which is a milky discharge from your breast. One, you are not breastfeeding, you've not given birth before, neither are you pregnant, you just notice that you're using breast milk. This can even happen to men too. It's confusing, it's strange, it's even embarrassing. But you do not have to worry, because that is what I'll be talking about in today's video. I'll be explaining what really goes on in your body when it starts producing that milk and what you can do to stop it. My name is Vera. I'm a pharmacist, and this YouTube channel is focused on health and health related talks. This condition is known as Galactorrhea. It simply means that your body is producing breast milk when it's not supposed to. It's not restricted to women alone. Men also experience the same thing. So in the body, there's a tiny gland which is known as the pituitary gland. This gland is like a command center for many hormones, and one of those hormones is prolactin. Prolactin is the hormone that tells the breast to start producing milk, and the level of this hormone usually rises during pregnancy or breastfeeding. But sometimes, abnormally, it just rises and then the breast starts producing milk. It can be just one breast or even both. This condition is common in women between the ages of 20 and 40 years old, but not limited to that, because some cases have been seen in older women. And for men too, your breast suddenly becomes tender, swells up, and starts producing milk. This is a signal for not just one part of your body. Now, what really causes this condition? The first we'll be talking about is hormonal imbalance. This is seen when there's an increased level of prolactin in the body above recommended range, and then a reduced level of estrogen, that's for women, and a reduced level of testosterone, that's for men. It can also be caused by stress. It can be caused by change in the signals sent to the brain, and even thyroid disorders too. So hormonal imbalance is one leading cause of this condition. When your prolactin level increases, that is how you start producing breast milk without even being pregnant. The second cause of this condition is the intake of certain medications that are used for the treatment of depression, like amitriptyline, can increase your prolactin levels. We also have antipsychotics that are used in the treatment of mental related issues like bipolar, schizophrenia. This medication can lead to an increase in your prolactin level, which can result to the production of breast milk. Another is the intake of blood pressure lowering medications. These medications can also cause an increased level of prolactin. The third cause of this condition is known as pituitary tumor, which is usually benign. It's a small non-cancerous tumor in the pituitary gland, and it is known as prolactinomas. This tumor leads to an increase in prolactin levels, leading to production of breast milk. Some of the symptoms include dizziness, headache, and even blurry vision. The presence of these prolactinomas can shoot up your prolactin level. Another cause of this condition is the intake of certain herbs like fenugreek, anise, or fennel that is normally used in nursing mothers to boost the production of breast milk. For in others, it can cause galactorrhea. That's the production of breast milk when the person is not even pregnant or lactating. So these herbs, fenugreek, anise, or fennel, can actually boost breast milk production in nursing mothers, but can cause galactorrhea in other persons that are not pregnant or even nursing a baby. Another cause of this condition is chest stimulation, overstimulation of the chest area. That's by putting on really tight bra when you have nipple piercings, and overstimulation of the nipples too. Overstimulation of that area could send a signal to the brain that, oh, there's need for breast milk production. So this can also lead to production of breast milk. Let's be real here. Producing breast milk when you are neither pregnant or you're breastfeeding a child can really be scary, can be embarrassing, and can even be confusing all at the same time, because some people think it may be a sign of cancer, others think this is something I should be ashamed of and I shouldn't talk about to anybody. Others don't even know if they should be worried or concerned about it. They cannot really wrap their heads around what is going on in their body. But I do not want you to worry. I've just mentioned the causes. So now we'll be talking about what you can do, what you should do once you notice that you are producing breast milk, even though you are not pregnant or breastfeeding a baby. So usually what happens when you go to meet your doctor and complain about this condition is you be asked to carry out a number of tests. The first is to check your prolactin level. Like I said, when there's an increased level of prolactin, this is the major cause of this condition. So the doctor will recommend that you carry out a test to check your prolactin level. Another thing that you'll be required to do is to check your thyroid hormones. If it is underactive, that is lower than the normal range, this condition is known as hypothyroidism. Hypothyroidism can lead to an increase in prolactin levels, leading to increased production of breast milk. Because your thyroid also controls metabolism and hormone production in the body. You will also be required to check your productive hormones, testosterone for men and estrogen for women. For women, when you experience low level of testosterone and increased level of prolactin, you tend to experience irregular menstruation, low sex drive, and increased weight gain too may set in. For men, it's actually low sex drive because your testosterone level is low and your prolactin level is high. Checking of reproductive hormones is also very important to help figure out certain issues that may be contributing to this condition. These tests are usually very important. Aside this checking reproductive hormone, your prolactin level, and your thyroid hormone, another thing the doctor may require you to do is brain imaging, the MRI scan. It's not harmful, there's no direct contact with your brain like using a needle on your brain or something. It's just an imaging to just check if that tumor is there. Remember I spoke about prolactinomas, which is a pituitary tumor that is usually non-cancerous that could shoot up the levels of prolactin. Brain imaging will be carried out to check if this tumor is present and to check the size too. And that is when your doctor places you on certain medications after confirming the presence of this tumor. Some medications like cabergoline, bromocriptine can now be prescribed to help shrink this tumor. Most persons never need beyond taking these medicines. Once they start taking it, they notice that the breast milk stops coming out. And the reason for carrying out these tests is just to be sure that you are treating what it really is, not just treating blindly. So it's important to know what you are treating and why you are treating it. That's why it's important to carry out this blood test. Production of breast milk can cause erectile dysfunction in men, low sex drive, and increased weight gain around the belly area. So it's really important to treat these things as soon as you notice them. Another thing is medication review, and this is because certain drugs can tamper with the brain chemicals like dopamine. This dopamine helps to keep prolactin levels in check at all times. So when we start taking certain drugs, they may reduce the levels of these brain chemicals like dopamine, which will in turn lead to increased levels of prolactin in the brain. This will now lead to the production of breast milk when you are not pregnant or breastfeeding. Certain medications like the antidepressants can lead to changes in brain chemicals, and they include sertraline, fluoxetine, amitriptyline. When you are taking this medication, though it may not be the same reaction for everybody because we respond based on our physiological makeup, but this drug can lead to lower levels of dopamine, which is a brain chemical, and a low level of dopamine leads to a high level of prolactin, and this can lead to the production of breast milk when you are not pregnant or breastfeeding. Another set of medication that you should review is the intake of antipsychotics. Antipsychotics are medications used in the treatment of mental related disorders like bipolar, like schizophrenia. And these medications include haloperidol, olanzapine. If it was when you started taking these medications that the breast milk started coming out when you were not pregnant or breastfeeding, then you should check this medication and discontinue, then report to your healthcare professional immediately. Another thing is the intake of medications like verapamil, which is a blood pressure medication. It's used in lowering blood pressure. Verapamil is a calcium channel blocker. This medication can also affect hormonal signaling, leading to increased levels of prolactin that will cause this condition called galactorrhea. Another is the intake of birth control pills because they are actually synthetic progesterone or estrogen. When you take them, they can mimic hormonal fluctuations and can lead to production of breast milk. So you should review these medications either on your own, the medications you are taking, you know the ones you need to discontinue, and the ones that you may need to see your healthcare professional. Mental conditions, you may need an alternative, so just see your healthcare professional and complain to them. Medications that are used for GIT related conditions like metoclopramide can also affect your prolactin levels. They can lead to increased level of prolactin, leading to increased breast milk production. For some nursing mothers use it when they are not producing breast milk. But then if you are taking it for GIT related conditions and you notice that you started producing breast milk, you should discontinue immediately and see your healthcare professional. Another thing you need to do once you notice that you are producing breast milk without being pregnant is to reduce the chest stimulation. Some of us cannot just get our hands off our chest. We keep touching it. We keep stimulating our nipples, which is one of the major reasons, because the body is wired to respond to touch. Because for women that are breastfeeding, there's a way they squeeze their nipples and it starts producing breast milk. That is understood. But when you are not breastfeeding, you are not pregnant, and your hands are always there, the body is wired to respond to touch. So as much as you can, you should reduce the chest stimulation. This will save you a lot of stress. It will save you from production of breast milk, because our body types are different. The way your body responds to it may not be the way another person responds to it. So as much as you can, you should reduce chest stimulation. So in order to reduce chest stimulation, you can try to put on bras that are perfectly your size, that are not too tight and pressing against the breast tissue. Another thing you should do is to wear breathable clothes, not always tight clothes. Overstimulates your chest. It's always in contact with your nipples, too tight for you. This can send signals that there's need for breast milk production. Another thing you may need to do is avoid pressing, rubbing, or constantly touching that area to check if there's milk production, because some of us may have had episodes of galactorrhea in the past, and then you keep checking to see if milk will come out at some point. You are just going to cause more issues for yourself and make this milk to start coming out. So as much as you can, just try to do these things I just mentioned. Another thing you need to do is to reduce stress, because aside overstimulation of the chest, stress is also another major cause of this condition. That's the fourth thing you need to do: lower stress. The body is stressed for a long time, the body will go into survival mode and start looking for ways to survive, and that is why it will release a hormone known as cortisol, which is the stress hormone. This hormone will try to keep the body in check till this emergency mood is done with. So when this stress hormone is released, it will help to keep the body in check. But when you become stressed for a long period of time, cortisol level may continually increase. An increased level of cortisol for a long period of time can lead to some hormonal imbalance in the body, as the body is already in a survival mode. This hormone called cortisol can lead to an increase in the level of prolactin. An increased level of cortisol leads to an increased level of prolactin in the body, which can cause galactorrhea. That's the production of this breast milk. So as much as you can, try to rest. You can relieve stress by engaging in recreational activities, by hanging out with your loved one, meditating. Just try to get a lot of rest. Prolactin levels will gradually adjust to the normal range. I hope you have found this video helpful, because many persons have reached out. There's a short video I made about this condition and people kept asking, what should I do? This is what you should do. So you should go over this video again and again to get value from it. Thank you so much for watching this video. Please do well to share this video with your loved ones. You know, one or two persons that may have complained to you that, oh, I'm suffering from this or that. Please share this video with them and give this video a thumbs up and share this video. Subscribe to my YouTube channel if you haven't. My name is Vera. Thanks for watching.